Hello, my name is Joyce Wheaton, and I'll be giving a video. I'm going to examine a 23-year-old black female that came into the clinic with hypertension and anemia. Hi, my name is Joyce. I'm going to be your nurse today. How are you doing?
Good.
Okay. Well, what is your name?
Amanda.
Hey, Amanda. I'm going to ask you a couple of questions first before we do your physical exam, okay?
Okay.
All right. This is in regards to your health history. Do you have any current medical conditions?
2 months ago, I was diagnosed with hypertension and anemia.
Okay. Do you have any chronic illnesses?
No.
How about any current medical treatments?
No.
Are you taking any medications right now?
I take lisinopril, 5 milligrams once a day, and multivitamin with iron.
Okay. Are you allergic to anything, food or medications?
No.
Okay. Past health history. Did you have any childhood illnesses?
No.
How about previous conditions?
No.
Have you ever had any surgeries?
No.
And have you ever been in the hospital for anything?
No, except for when I was born.
Okay. Hey, and this is in regards to your family history. And I'm going to ask you a couple of questions in regards to their age, current health, and if they're deceased, what age did they die, and what did they die of? What was the cause of their death?
Okay.
Okay, your maternal grandmother?
My grandmother is 79. She has high blood pressure, but she's in pretty good health.
Okay, what about your maternal grandfather?
He died when he was 50. He had heart disease.
Okay, what about your paternal grandmother?
I don't know who my father is, so I don't know anything about that side of my family.
Okay, do you have any brothers or sisters?
No.
Okay, and how's your mother's health?
She has high blood pressure too, but she's in good health.
Okay, and this is in regards to family social relations. How about significant others in your life?
I have some pretty good friends.
Okay, who lives in your home?
Just me and my mom.
Okay, and what is your role within the family?
I'm the good daughter, and I take care of myself.
All right, this is in regards to your diet. How's your appetite?
I have a good appetite.
Okay, give me a typical food intake for 24 hours.
So yesterday I had cold cereal for breakfast, hamburger and french fries for lunch, and grilled chicken sandwich and french fries for dinner.
Okay, is that usually, that's your meal that you take in?
Yeah.
Okay,
Yeah.
okay. Okay, and to perform, how do you perform your activities of self-care?
I do everything by myself.
Okay, and coping skills, do you have anxiety, depression, any stressful situations going on?
No, I have pretty good mental health. I don't let anything bother me. I have strong faith in God.
Okay, that's very good. How about personal habits? Do you smoke?
No.
Do you drink alcohol?
No.
Do you use any illegal drugs?
No, I don't use any type of drugs.
Okay. How about prescription medication like pain pills or prescription pain pills or anything?
No, ma'am.
Okay. How much do you exercise?
I walk about 30 minutes twice a week.
Okay. And do you do breast exams?
No, except for like my annual checkup.
Okay. What about brushing your teeth and flossing?
Twice a day.
Oh, okay, that's very good. And safety in your home. Do you have smoke alarms, fire detectors, fire extinguishers?
We have smoke alarms and fire extinguishers in my house.
Okay. You guys might want to check into those carbon dioxide. I know your house, you said you've lived in your house for a good while, but they may have the carbon dioxide detectors on them also. Okay. How's your work environment safety-wise?
Oh, it's good. I have a good work environment.
Okay. This is a 23-year-old female with mild hypertension, complaining of feeling tired, and she was diagnosed with anemia also. Particular needs, I would say, would be dietary concerns, exercise, and breast exam. My expectations are good. My short-term goals patient will improve diet by adding fruit and or vegetable to each meal. Patient will not add salt to any meals, and patient will cut down on french fry intake to maybe once a day. Patient will also do monthly self-breast exam. Um, what are your life goals, life tasks?
I want to keep working, be a good, productive member of society and have a family, but not too soon. Just, I want to have someday.
Okay. All right. Okay, now we're going to go into doing your physical exam. Would you step up on the table for me, please? Okay. Let me wash my hands. I'm going to put on my gloves. Okay, a couple of things. I'm going to start out by looking at your eyes, okay?
Okay.
I'm just going to take a look at them. No lesions, no nothing. Eyebrows look good. Okay, very good. I'm going to use this pen light. And I'm going to shine a light into your eye, okay? A couple of things I'm checking for. Make sure they're reactive to light. I'm going to check for strabismus. That's like cross-eyedness, okay? And then check cranial nerve, too. Okay? Very good. Okay, now the other thing I want to do is I want to have you follow my finger, okay? Okay, let's do it with the other eye. Okay, and this is checking some other cranial nerves, okay? Okay, let me see how your vision is. Can you read, cover one eye?
Okay.
And then just read the first line right there.
I read with interest the article on Mayor.
Okay, and then cover your other eye and read this sentence.
Please stop referring to Kendall and Kylie.
Okay, that is very good. Your sight is good. Okay. Now your vision is tested out pretty good there, and now now I'm going to do something. I'm going to look at listen to your heart. I'm going to listen to your lungs first, okay? So I'm going to do that first. Okay, I need you to take some deep breaths for me, in and out. Again. 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 One more time. Another time. Okay, I'm going to listen to your sides there. Okay, over here. Okay, we're going to do the same thing on your back. I'm going to listen to your back. Take deep breaths in and out for me. Again. Again. Okay, again. All right, again. One more time. Okay, good. Okay, one of the things I'm going to do, I'm going to check for dermatitis. I'm going to palpate. Okay. I'm going to check on the front. Okay, very good. Okay, now the other thing I'm going to do is I'm going to go to your heart now. But first of all, I want to check your veins in your neck, okay?
Okay.
So I want you to turn to the side. I'm checking for distension. Okay, let's check the other side. No distension. Okay, that's good. Okay. Now just breathe normally. Okay, now I'm going to listen to your heart, okay? And you know, you have 4 valves in your heart, okay? 4 of the main valves that I'm going to be concerned with. And the first one is the aortic valve, so I'm going to listen here. I'm going to listen with both ends of the stethoscope. Sometimes you can hear a different pitch when you listen to the other side, okay? Okay. And the next one is the pulmonary. On both sides. And the next one is the tricuspid. And I'm going to listen to the other side. Okay, and the last one I'm going to listen to is the mitral valve. Okay. Very good. Now the other thing I'm going to do, I'm going to listen to your heart while I'm checking your pulse, okay? I'm gonna do this for 1 minute. And this we're just checking to see if there's any difference, okay? I have a clock back there on the wall in case you're wondering what I'm looking at.
Okay.
Okay. Okay, good. Now I'm going to check your other pulses. It's your brachial. Up here. I'll check your brachial over here. Okay, I'm going to check your radial pulses. Good. Okay, I'm going to check the pulses behind your knee. They're called the popliteal.
Okay.
Okay, and then I'm going to check the pulses on the top of your feet. They're dorsalis pedis. Okay, very good. Those are all your pulses. Now, the other thing I would like to do is, I want you to lay down so I can look. And when you lay back, I'm going to put a sheet on you, and I'm going to put the stool so you can rest your feet on, okay?
Okay, thank you.
All right.
Thank you.
Okay. All right. Now, I'm going to look at those veins again in your neck, okay? Sometimes you see a different angle when you, okay? And now can I have you turn the other way, please? Okay, very good. Okay? And now I'm going to inspect your stomach, okay? Just going to kind of peek at it. Okay? It's not shiny, okay? Looks good. I'm going to listen to your stomach, okay?
Okay.
And I'm going to listen in all 4 quadrants. You have the balsams. I'm going to listen up here by your diaphragm, okay? All in the steps. Now the other thing I want to do, I want to palpate on your stomach. Do you feel any tenderness?
No.
Okay. And I don't feel any masses or anything. Okay. Now, okay, that's good. Okay, will you sit up, please, for me? Thank you very much. Now I'm going to check your reflexes, okay?
Okay.
I'll start with your biceps. Just kind of relax your arm a little bit. Okay. Okay, now put your arm there. I'm going to do your triceps. Okay. Okay, let me do your brachial radial. Okay, let's do the other side. Okay, I'm going to do your biceps. Just kind of relax. Okay, and I'm going to do your triceps. I'm bring your arm back. And then I'm going to do your brachial radial. Okay, good. Now I'm going to do, okay, we have a little malfunction there. But now we're going to do your knees, your patellar reflexes. Okay. Okay, just kind of relax. Okay. Let's do your other one. Good. Okay, now I'm going to check your Achilles. Kind of dorsiflex your feet. There you go. Put your feet in an upward position. Okay? Okay, now I'm going to take off your shoes and check your reflexes. It's your plantar reflexes.
Mhm.
Okay. Now I'm gonna have you walk for me, okay?
Okay.
Help you with your shoes here.
Thank you.
Okay, can you walk over to that chair on your tippy toes, please?
Okay.
Okay, now come back. Now do the same thing on your heels. Okay, now can you come back?
Mhm.
Okay, now we're gonna do the thing, it's called a drunken test. It's really called Rumberg, okay?
Okay.
So I want you to stand with your feet together, hands to your sides, straight up, and close your eyes. And try not to drift. We're gonna do this for 1 minute. Okay, and I'm standing close to you, you know, so you won't fall or anything.
Okay, good.
Okay, that's it. Thank you. That completes your exam for right now.
Okay.
A couple of things we're going to talk about is I went over your whole exam, and it's pretty normal. I think what we need to do is increase your exercise. We start with short-term goals. So you're walking 20 minutes, twice a week, 30 minutes. You should increase that to 30 minutes, 3 times a week at least, okay?
Okay.
And the other thing is your dietary intake. We've already talked about it. We need to go down that food chain again, okay?
Okay.
We need to add some fruits and vegetables to your diet, okay?
Okay.
At each meal. We need to add at least a fruit or a vegetable, or fruit and a vegetable to each meal.
Yes, ma'am.
Okay, the other thing is cut down on some of those French fries. They're very high in sodium, and that will have a tendency to make your blood pressure rise.
Yes, ma'am.
Make sure you're checking your blood pressure every day, okay, prior to taking the medication. Notify the doctor if you go over 140 and it says stay sustained at that rate, okay?
Okay.
140, that's the top number, and the bottom number if you go over 90 and it stays that way, you know, for a period of a couple of days, you know. And if you're feeling any type of dizziness or anything like that, continue to take your diet. Can take your vitamins and your medications.
Okay.
Okay. Also, breast exam. They're very good. They're the best way to prevent breast cancer. So early detection, that is the key. So we need to do those monthly breast exams. Okay.
Okay.
Overall, you've done very well. Just keep up the good work. Keep trying to do the right things, trying to eat a little better, and take good care of yourself. I do thank you for participating in this physical exam.
Thank you.
All right. Have a blessed day.
You too.
All right.